Good afternoon. Welcome, everyone, and thank you for joining our session on supporting the pediatric community. We hope that you all are having a great national conference so far. I know I've enjoyed the last 2 days, and I'm looking forward to what the remainder of the conference holds for us as staff, as well as for all of our attendees. So thanks again for taking time out of your afternoon to be with us. I'm Tonya Osborne-Simpson, the Director of Support and Outreach and Certified Master Trainer with the Amputee Coalition. I joined the coalition in 2015, and I oversee the National Limb Loss Resource Center as well as the Peer Support Department. Today, I'm joined by my co-lead, Dr. Anna Vergun, pediatric orthopedist with the University of North Carolina at Chapel Hill, and president of the Association of Children's Prosthetic-Orthotic Clinics. In this session, I will highlight the Amputee Coalition's programs and resources, including our Youth and Family Certified Peer Visitor Program, our youth engagement events, our biannual youth newsletter, our resources offered by the National Limb Loss Resource Center for the pediatric community. Then we'll be joined by Dr. Vergun, who will discuss pediatric research collaboration for parents and how to locate a provider utilizing ACPOC resources. We'll leave about 15 minutes at the end of our session for Q&A. Couple technical housekeeping things. I'm sure you guys are all getting the hang of it by now, but in the upper right corner of your screen, you'll see a box labeled Live Discussion. And in that box, there's 3 tabs. There's a Chat tab, a Questions tab, and a Polls tab. So please feel free to use the chat functionality throughout our session so you can interact with other people that are in this session, or you can post questions there as well. And we'll have a session moderator who can help to monitor those questions and respond to you. You can use that middle tab to ask questions that you would like addressed in the Q&A portion at the end of our session. There should also be some poll questions in the very last tab labeled Polls in that box. And if those are preloaded there, please feel free to go ahead and answer those at your convenience during our session. We would love your feedback on those. Thank you guys for all your help with that. Told you guys we're going to have a session moderator that's going to be in the chat. It's usually someone that's a staff with the coalition, so it may be Nicole or Susan or Priya. I hope you've had a chance to meet them this week already, but they'll be helping guide us through our discussion and then also helping with Q&A at the end. So I believe that covers everything for technical housekeeping. So let's get started. Let's kick off with our youth and family programs. So as many of you know, at the heart of the Amputee Coalition's mission is our peer support programs. Our goal is to make sure that no one goes through this journey alone. We believe that support comes in many forms and can make an incredible difference in the recovery and rehabilitation of youth and their families. The coalition has been providing nationally recognized peer visitation training since 1993, so we've been at this for a little while. Our CPV training helps individuals acquire and practice the skills necessary to provide peer support and education to others. We've trained over 1,500 certified peer visitors to meet with individuals and family members in their greatest times of need. Traditionally, we have provided training for adults living with limb loss and limb difference, as well as their partners or their caregivers. In 2018, we launched our Youth and Family Certified Peer Visitor Program as a pilot with Children's Healthcare of Atlanta. There, we trained our first ever junior certified peer visitors and their parents. This training is available to youth ages 13 to 17 who are living with limb loss or limb difference and their parents or caregivers. Youth and their families attend this training session together and become certified as a family visitation team. Once the team successfully completes the training, they're able to conduct peer visits with other families. In addition to our CPV program, we also offer hospital partnerships with children's hospitals across the country. Our partnerships with children's hospitals provide us the opportunity to deliver our youth and family CPV training program, as well as distribute our valuable educational resources throughout the hospital systems. In addition to that, the coalition also oversees a national support group network of over 400 support groups throughout the country. You can search for pediatric-specific support groups on our website. And I'm going to give you guys that web address just in case you don't have it. I think it's on my last slide. Let's chat about our youth events. 2020 has been an interesting year for all of us, and I think that I am not alone in saying that's an understatement. All of our events that we are accustomed to hosting in person have either been canceled or transitioned to virtual platforms like the one we're using today. Our youth events were no exception this year. Due to COVID-19, our in-person youth camp was canceled, and we shifted to virtual with the support of our campers and parents. We engaged external experts to evaluate our virtual camp curriculum and provided a 6-day evidence-based protective virtual event focused on quality of life areas through STEM activities, team building, breakout sessions, cabin chats, and virtual games. We conducted virtual pre-camp trainings for our counselors and leadership campers focused on cyberbullying, online safety, mandated reporting, and lesson plans for all activities. The virtual camp experience allowed us to connect with and support our campers and counselors, and together we celebrated our 20th anniversary, staycation style. Having overcome the transition from in-person to virtual obstacles, we're now looking towards future virtual events for our youth community. We're planning a virtual youth con. It'll be an event very similar to our Limb Loss Education Days, for those of you that are familiar with our LLEDs, and a leadership retreat for young adults ages 18 to 25, focused again on those quality of life areas, independent living, and transitional life skills. Stay tuned for more details on those events as we work through the planning process. I'd love to also take just a moment to encourage you all to sign up for our youth newsletter. This is new in 2020, and we're so excited about this resource. It's a free electronic resource delivered directly to your inbox and only 2 times a year. So we promise, we know we send out a lot of mail. We have a lot to brag about and a lot to keep you all connected with, but this is a really great resource that you can share with your youth. You can share with your patients if you're a professional. It is full of spotlights on our youth and family programs, our upcoming youth engagement events, and youth resources. You can sign up really easily by emailing a request to youth@amputee-coalition.org. That email address comes directly to myself, Daniel Carroll, and Natalie Atkins, who hopefully, again, you'll have a chance to meet this week. And the 3 of us tag team the efforts to make sure that our youth and family community is supported and that you all get the resources that you need. Lastly, I'd like to just briefly touch on the Coalition's youth and family resources. The National Limb Loss Resource Center is the nation's leading source of information related to limb loss and limb differences. The Resource Center provides comprehensive information and resources free of charge to community members, families, caregivers, and professionals. The Resource Center also this year launched our newest resource, which is Community Connections. Hopefully some of you have had a chance to use that already. And if not, I encourage you in your spare time during conference or post-conference to go check that out. Community Connections is an online searchable database filled with resources at the national, state, and local levels. You can access the database right on our website. It lives right on the home page, or you can search Community Connections. We've also spent a lot of time in 2020 enhancing our mobile support app. The Coalition's support app is free and was designed for those living with limb loss, limb difference, and their caregivers. This app embodies just the power of connection and the power of peer support. It also has valuable resources that you can get on our website right there on your phone within the app. So you can request materials and resources right from within the app and not have to go out to another external platform. The app is HIPAA compliant. We get a lot of questions about that. So we do want you to know that it is 100% HIPAA compliant. And it is available on your Apple or Android devices through your App Store and the Google Play Store, as well as through a web browser. And I've put the link there on the slide, so feel free to take a picture of that or jot that link down so you can go and see what the web link is all about and see how our app works if you haven't had a chance to download it yet. Lastly, I just wanted to mention our strategic partners that we are so thankful for, and we're so excited. Our partnership program is just exploding this year. I believe during conference, we may have signed another hospital partner up, and that takes us to 51 across the country. And if you haven't had a chance to meet with Nicole Gross, please find her in the networking lounge or send her a connection request. Nicole oversees our strategic partnerships and is doing a phenomenal job at that. So our hospital partnerships and our strategic partnerships offer us the opportunity to share our expertise and our training curriculum and patient education materials so that hospitals can easily integrate our highly successful peer program. We love bragging about our peer support program. It's one of the things that we really enjoy doing, and like I said, is at the heart of our mission. And it gives us an opportunity to share that with others and help them embed that and implement it within their facilities free of charge. It is 100% fee-free to sign up as a hospital partner. So like I said, track Nicole down if that's something you're interested in for your hospital, if you work with a hospital or rehab facility, or if it's something that you'd be interested in connecting with a hospital in your area. In addition to expanding our national hospital partnership network, we also have partners with the United States Department of Veterans Affairs, the United States Department of Defense, and MIB agents. And those three partnerships allow us to offer co-branded materials for our servicemen and women, our veterans, their families, as well as individuals living with osteosarcoma or those that have recovered from osteosarcoma and are now living with limb loss. These strong dynamic partnerships offer us extended platforms in which we can reach more individuals living with limb loss through our peer support programs and distribution of coalition education materials and resources. You can learn more about our strategic partnerships and any of the resources that I've mentioned in this brief overview by clicking on our website. It's there on the screen, amputee-coalition.org, or giving our National Limb Loss Resource Center a call at 888-267-5669 and press extension 1 to get directly to a Resource Center specialist. That is all for the Amputee Coalition side of things for now. I'm going to hand it over to Dr. Vergun to cover pediatric research and finding a pediatric provider. Anna?
Hi, my name's Anna Vergun. I'm a pediatric orthopedic surgeon at UNC Chapel Hill in North Carolina, and I'm here today to talk to you about a collaborative effort between the Amputee Coalition, AKPOC, and the American Congress of Rehabilitation Medicine for reaching out to families and essentially doing a needs assessment. This has become a collaborative effort over the past few years, and I'm hoping for, first of all of your feedback, but also ultimately hoping that everyone listening today can help spread the word about the survey and get involved. So here we go. So again, there's 3 entities, 3 questions, and 1 patient population. So the Amputee Coalition is going to be exploring the knowledge gaps for parents and for patient education resources. At ACPOC and UNC, we're interested in knowing more about the barriers to the care and mobility limitations. And the ACRM is interested more in the unmet prosthetic needs in pediatrics. First, I wanted to review the results of our pilot study that was completed last year. We presented this at ACPOC, and it's now being expanded and refined. This was an IRB-approved study with a HIPAA-compliant database called REDCap. There were 4 major sections. These were demographics, local providers, family support and resources, and then finally questions on recreational activities. The survey was distributed via the Amputee Coalition, via their website, and I think there was an e-blast that went out. I distributed it to some of my patients in our local clinics. We also spread the link via the PFFD Facebook group, and the link was also tweeted on several sites. There was a small group of responders, about 30 to 40 families replied. And here's our results. So most were satisfied with their providers. Here, if it's hard to read some of this fine print for some of you possibly. So the red is extremely satisfied, and as it goes through the rainbow, the cooler colors, the blue here, was extremely dissatisfied. We had mixed results regarding how people felt about their sources of information, and this included medical providers, family members, internet searches, social media websites, and then other resources. Many traveled far to reach their orthopedic surgeons and their prosthetists, but other providers tended to be more accessible and closer to home. Here, red is less than 30 minutes, yellow is 30 to 60 minutes, green 1 to 2 hours, blue 2 to 3 hours, and the dark blue is more than 3 hours. The time to first meet with other specialty providers was mostly split between what was felt to be too long and just right. Notably, none of them were too short. For most families, waiting 1 to 2 months to first meet a provider was acceptable. 3 to 6 months was split between just right and too long, and most thought 6 months was too long. Half responders found it difficult to find a provider that they liked, and a quarter of those said extremely difficult. For most families, waiting 1 to 2 months, oh, I'm sorry, wrong slide. The vast majority wanted their children to be involved in sports. However, a third of families thought that their child needed a sports-specific prosthesis, but most didn't have access. And there was a long list of concerns about how to get involved. These included being too expensive, problems using the prosthesis, didn't have a sports prosthesis, no interest or prefers non-athletic activities, not sure how to choose the right sport, no sports programs available that are appropriate, facilities not adequate for my child's needs, local leagues not adequate for child's needs, wants to participate but feels too different, has another medical problem, has pain that limits participation in sports, and then other. Since then, we've expanded the collaboration. First, it started with ACPOC, and now it involves the Amputee Coalition as well as the American Congress of Rehabilitation Medicine. And the hopes is that we'll be more comprehensive with the survey and have a wider outreach. So just quickly a little bit about ACPOC. For those of you who joined us previously, you've learned all about ACPOC. This is an international group of medical professionals. It includes physicians, prosthetists, orthotists, physical therapists, occupational therapists, nurses, social workers, and engineers. The Amputee Coalition, hopefully you're all familiar since you're attending our meeting. They've done a wonderful job with both needs assessments and working with advocacy within our country. Then there's the American College of Rehabilitation Medicine. This is a multidisciplinary group, actually quite similar to ACPOC. It's mainly focused on adults, although there is a peds, there are some peds tracks. So for the past 3 years, our groups met working with the survey, and the questions have been reviewed and refined by the Odom Institute. This is a leader in survey development at UNC. And we've also had some feedback from our ACPOC members. We're now making our final revisions. I'm hoping that the families listening today will participate, and I wanted to hear more about your experiences once the Amputee Coalition sends the link. So here's a little bit of what to expect. There's 6 major sections. There's demographics. There's an early information section asking about how information was obtained, what resources you used. There's a surgery section for those who've undergone surgery. This includes preparation for surgery, what information is missing, what was surprising. There's a social support section which asks advice to other ask what advice you would give to other parents and what organizations were helpful, what organizations your child has, what organization events your child's attended. The prosthetic section is about finding a prosthetist and finances, what that experience was like. And then the physical activity section asks about the desire and ability to participate in sports and what barriers there may have been in achieving desired participation. So I would absolutely love to hear from all of you today. I want to know if there were any surprises from the pilot survey. Do you think that the main domains, so the big categories, are comprehensive enough? And any ideas that you have so that we can have a wide distribution and get as many responses as possible. Thank you so much from all of us, and I can't wait to connect with you in the live session. Hi, my name is Vergun, and I wanted to talk to you today about how to find a provider. I'm a pediatric orthopedic surgeon at UNC Chapel Hill in North Carolina, and I love working with children, and I love working with limb differences and amputees. So welcome, and thank you for having me. So I wanted to start with some words that I've heard from you, and in truth is what has inspired me to come to these meetings. I had a family say to me once, I didn't even know the words to use for my internet search. This was a family who had a child born to them who only had half of their pelvis and was missing the rest of the limb on that side. Our pediatrician said they'd never seen this before. We found out about a limb difference during our prenatal ultrasound, and we learned what it is, but nothing about how it's treated. Is it weird to take a mold of my child's foot before amputation surgery? And I just heard this just last week, and it reminded me that this is a family who, and partly due to COVID, I think, just has not been able to connect with other families who have children with similar needs. And also just how to prepare for when your child's getting an amputation. So clearly, clearly the answer to that is no, it's not weird. And I realized this is a family who had I'm sure a lot more questions than just that. And we didn't even know there were support groups for families. So here we are, and my goal is to get people connected. So I want to start by telling you about ACPOC. This is a professional organization that's roots go back to 1946, when Dr. Charles France and Drs. Eichen and, make sure I don't leave anyone out, Dr. Carlton Dean began the juvenile amputee program in Michigan. And they recognize that children are not just little adults that can abide by the same principles for when making prostheses. You know, they have different developmental stages and different needs. And so their collaborative meetings eventually grew into what we today call ACPOC. So ACPOC is an international group of medical professionals. It includes physicians, prosthetists, orthotists, physical therapists, occupational therapists, nurses, social workers, and engineers, all working towards creative solutions for children who have very subspecialized needs. Everything we do is based on a team approach, and I'm probably preaching to the choir here if you've made it to this meeting, but it really takes a village to be creative and make sure we're providing the best care for everyone. There are a number of studies out there showing that team approaches are important for unusual or complicated scenarios. So just to kind of make that point, you know, some of the things that we collaborate on are the following questions. So when do you change the prosthesis, and when do you change the limb? So this is a conversation that can happen between a prosthetist, a surgeon, and a physical therapist. So the surgeon may look at this and say, well, I don't think that that foot looks like it's going to be very useful, and it might get in the way of the prosthesis. Maybe we should do an amputation. But clearly the prosthetist here has found a very clever and effective way to incorporate the foot into the prosthesis. And you may have the physical therapist saying, well, thank goodness, because the sitting balance is better when, you know, when we have a wider base for the child. So those are conversations that are important to have. When will the walking get better with therapy, or does the prosthesis need to be changed? So this comes up for above knee amputees and the types of knees that they have, and when children are falling and learning how to use their knee, is that something that will get better? Is that a normal thing for a child? Or is the knee too complicated? And those are questions that come up all the time. As a child grows and learns new tasks, how can the upper extremity prosthesis be changed to keep up with development? You know, children have different developmental stages and therefore have different needs at different stages in terms of learning how to pick things up and eventually more independent function with self-care. What about adaptive sports and other medical issues that are specific to my child? So the physical medicine rehabilitation doctors are particularly adept at knowing how to answer some of those questions and really steer a team for the sort of larger environment of the child. So here are the faces behind the organization. This is our board several years ago when we met. We're all looking kind of nice and professional, and that's true, but the real truth is that we're all extremely passionate and love what we do, and we really love each other. So this, I think, embodies our organization a little bit better. We have fun and we really care, and we share that deep love for what we do. Here's some more photos of us at other meetings. It's our annual meeting. And then some of us do some collaborative work abroad. This is me and Ramona Okamura. We were in Gaza last year, and we're starting an amputee program there for children. So, you know, it's ongoing efforts everywhere. So here is our website for ACPOC, and this is where you're going to go to essentially connect with a provider. Want to direct you to the professionals drop-down menu. This is open to everybody, including parents, and right now this is where we house our information about our members, but I want you to know anyone can use it. So go to find a member, and here we are listed by our names in alphabetical order, which is great if you know our names, but if you do not, and you're just looking for someone locally, you can type in the state, and it'll bring up everyone in the state. So that's me in North Carolina and my colleagues. You can also go to geographic listings, which essentially shows the same thing. It's just listed in alphabetical order by the state. So you can find someone local, and that's all of our contact information. And if you just have a general question that really isn't region specific, you can email us at acpoc@affinitystrategies.com, and that will go to our board, essentially. And board is multidisciplinary, and we can field your questions that way. And sometimes we'll connect with you individually. Sometimes we'll have our management relay an answer to you if that's more appropriate. So it just depends on what you're asking. But don't be shy. We love getting questions. And then under the parents link, you can see that there's other drop-down menus for support groups, adaptive sports, camps, fitness, recreation groups, transition resources. That's for our adolescent children who, sometimes it's kind of scary going from a sort of pediatric team-centered approach to the adult world. So those are links to help navigate that. And then technology and resources, meaning types of components, or other prosthetic wares, and then resources. The resources link is a general link, and it has access to all kinds of print materials, books, magazines, as well as other links to websites that we thought were useful. So my advice to families that I want to share with you is that the best care is good care close to home. Okay, and if you can't find that, because it's, if it's close to home, it needs to be good to be acceptable. So if you can't find that, we can sometimes have you travel to come meet us, and then we can kind of help guide your care, perhaps by working with a local provider. And of course, we'll want them to be part of ACPOC. But we're willing to work with anyone to kind of help make things work. If you feel like something isn't right, it's because it probably isn't. Okay, so trust your gut and don't be shy to reach out and get a second opinion. And then I also want families to know that they should never feel pressured into surgery. This comes up sometimes. There are always other ways to accommodate a child's mobility needs and developmental needs, and surgery is there for if and when you're ready. Okay, and I already said this, it's okay to get second opinions. And use your resources, so hopefully you'll find ACPOC to be a good resource. My advice to other providers is please don't be shy. Contact us at ACPOC. Join ACPOC. We're passionate about what we do, and we love hearing about new challenges and figuring out how to help. So that's it. Thank you very much for your time, and I look forward to any questions. Well, hi, everyone. This is Anna Vergun again. Thank you so much for joining us. And I guess the floor is open for questions. Let me turn my camera back on. Hopefully you all can see myself and Tonya. I'm going to go to the public.
I do not see any questions listed in the questions box, but I think that Nicole and Priya have been helping out on the chat. But gang, if there's anything at all that you all have questions about, if we can help with resources or research questions or anything like that, please feel free. We've got a few minutes left.
Tonya, I have a question for you while we're waiting. Can you talk about what future camp sessions there might be? I know that you were talking about the virtual staycation kind of camp that you guys had this summer. Yeah. Are there more on the horizon? You know, everyone's school is starting, but there's still, you know, scheduled breaks in school. Is there anything available like that?
Sure, that's a great question. So we do our camp, it's only once a year, and it's always in July. We just, at the Amputee Coalition, we love to pack everything into the summer months. So camp and conference are usually back-to-back or just a couple weeks apart. There's a list of resources on our website of other camps. Some camps do winter camps, some do fall, some do spring break. So if you're looking for things around the country or things that are maybe more convenient for your schedule and things like that aren't in the summer, you can always find those there. I think ACPOC has a great list of camps on their website as well. But for us, what camp looks like next year is, man, I wish we had a crystal ball for sure. We have no idea what it's going to look like next year. And we hope that we're still holding out hope that Camp and Conference and Limb Loss Education Days can be in person in 2021. But we are full transparency, trying to figure out and go ahead and have some backup plans for what happens if we have to go virtual again. So we love this platform. It worked really well for us this year during camp, and it's going well for conference. We've all had some learning curves with it, but I think by next year we'll all be pros if we have to do this again. But our hope is definitely to be back in person.
Okay. And then how many children could register or families could register for the camp? Is that, because I know that there's a limit physically, right, each year, how many kids can go to camp? Was that different this year?
It wasn't. This year we were ready to take on the world. It was a neat environment, a lot like this, where we have to say that campers need to be within the U.S. because that's where our grant funding allows us to spend our cooperative agreement dollars. But this year, because it was virtual and our camp is free, we were able to open it up to everyone. And so next year, we're hoping that I think in our strategic plan, we're looking at about 175 campers, 175, 180, something like that. So total participants with counselors and leadership campers would be around the 250 mark.
Mm-hmm.
Yeah. We're excited about it. This was we were all kind of bummed to spend our 20th anniversary, behind a screen, but it was such a neat way to get to be together, and the kids were really excited that we were able to offer something instead of just canceling. So it was a lot of fun. What about you guys? Do you guys have plans for 2021? I know you had to go virtual again, or you had to go virtual as well this year.
Yeah, we did. We went virtual kind of at the last minute because our meeting was at the end of March.
Nice.
So, and next year it's, I think we'd like to plan on something. It's really hard switching gears. So I think a lot of us would like to just plan on a virtual meeting, given all the uncertainty. There's some challenges to doing that, believe it or not. So we're working on it. There were some good things about being virtual, like people who couldn't travel could participate, and I think we're all getting used to a virtual format now. So maybe next year, if it ends up being virtual, we can get even more people to participate. And some of our emeritus members that were kind of the lifeblood maybe 10 or more years ago that we all miss hearing their voices, they could come. So that was really fun. Anyway, so we'll see. And even if we can't, even if it is in person, we've talked about having some kind of virtual format just to preserve the parts, that we liked. So we'll see.
We've done that too. We're thinking that the virtual is going to be a part of who we are forever now. We've been able to expand our reach, and for people that can't travel, for people that, they're not comfortable traveling, they can't afford to travel. There's so many reasons that events can be barriers, and this technology has proven that we can take out those barriers and open up the doors to more people. So I think it's something that will always be a part of our future events once the world looks a little normal again, and hopefully we can be back in person. But I'm excited about it. I'm excited about everything that we've all learned from each other. It seems like a lot of our industry and community events happen between February and August, and maybe even, September with AOPA, but it's, there's a lot going on, and I love it that we're all getting to learn from each other. I think we have 2 questions in the queue, which is exciting. So let me look there real quick. Elisa, thanks so much, Elisa. There seems to be a lot of disconnect between my medical providers with regards to my child's limb difference. Is ACPOC the best place to go to find a more team-based approach? I'm going to let you handle that one, Anna.
Yeah. I would suggest going online and, just as I had gone through the video, looking and seeing if there's a clinic that's near you, and I would recommend finding one there that is close to you and you could travel to maybe get a second opinion, or it might be a third or a fourth or a fifth, and it gets to a point where sometimes you've heard too much. And if that's a problem, then one of us at ACPOC can contact you and see if we know anyone in your area if it's not listed on ACPOC. So more than happy to help you navigate that. So if you even want to email at the Affinity Strategies email that you see up there, just with like your location, and we can help find a provider near you that attends the ACPOC meetings and it really understands that team approach to get you plugged in.
Perfect, thank you. Next question, also from Elisa, is it is hard to find a way to connect with other parents of children with limb loss outside of our adoption Facebook groups. Is there Facebook parent limb loss groups that you recommend? It's another great question. I'll take a stab at it, and then Anna, if you have anything to add, I'd love to hear your response there as well. So Elisa, for us, I think I saw in the chat, forgive me if I'm wrong, that you have a 5-year-old. I think that was you that I saw in the chat. There's a lot of Facebook communities out there. We tend to not endorse one over another just because we don't oversee them. So we are not, unfortunately, we just can't say yes that they would be great as far as their best practices and things like that. We have some private Facebook pages that you're more than welcome to request to join. You can look for our camp page is a great resource for families and children. Traditionally, it had been for it was kind of a legacy page. It was for camp alumni and people that had gone, and over the last several years, it's kind of grown to new campers and potential campers. And we're looking at creating a youth and family Facebook page, a private Facebook community where youth and families that have utilized us for reaching out for resources, or maybe they had a peer visit with us, that they can have a safe space to be able to pose questions or brainstorm or just chat with somebody else that can relate to what you're going through. So be on the lookout for that. I would also use this as a time to shamelessly plug our youth and family peer visitation program. If you want to get connected with other families in your area, or you're having a specific question that you'd like to chat through or anything like that, we have some wonderful youth and family peer visitors that I think you would enjoy connecting with. I think I saw that you were in North Carolina. We have a hospital partner there. So there's tons of resources. I would say reach out to Susan or Nicole. Either one would be wonderful. Priya also, I think she's also in the chat. She'd be great to connect with as well. Anna, anything to add?
No, I mean, ACPOC, just in terms of representing ACPOC, has a lot of links too, and there's some support groups on there. There is did I hear you say you were in North Carolina? Did I hear that? That's where I am too. So there is a Triangle Amputee support group if you're anywhere near Chapel Hill, Durham, Raleigh. And I posted my website, or I'm sorry, my email address there. It's my work email. You know, I have about 30 families that I see in my clinic, and many of them are happy to meet with other families. So if you go to the ACPOC website, my email is posted there. So you can always reach out to me as well, and I can see. But it's the other websites are great in terms of having lots of links. Okay.
I think that is all. Oh, Elisa says, yes, they're in Smithfield and they work in Raleigh. So Because it's hard to find a way to connect with other parents of children with limb loss outside. Oh, same question. Sorry. It just moved for me. I apologize.
Okay. No, that's okay. So email me, because if you're in Raleigh, we're very close, and I'm sure I can help you.
Of course. Thank you guys so much. We are 1 minute over our time, so I apologize for that. For those of you that have upcoming sessions that start in just a few minutes, we will give you all a few minutes to transition down the virtual hallways and get to your next sessions. Thank you so much for joining us and for being a part of it. Anna, thank you so much for co-leading with me and dealing with all of this amazing technology.
Still learning.
Thank you guys so much.